Deep breath in, out. Deep breath in and out. Skin on your face. Any pain around the eyes, any tenderness to the eyes at all? Also, do you hear it more on this side, or equally? What about tightness around the jaw? Do you clench your teeth? Okay. Hello, yes, it's wonderful to see you again. You're here for your annual physical exam, right? Yes. It was this time last year that I saw you, is that right? Yes, I know that the previous year was a little bit delayed, but I think we're back on track now, which is great. So let me just pull up your results from last time. Everything was totally perfect last time. All your blood tests results came back perfect. Really happy with everything. So in yourself, are you feeling well? You certainly look amazing. Keeping yourself in shape, yes. And your eating habits, exercise, all of that, has all that kind of remained the same? Perfect. Do you have any aches or pains at the moment? Anything you would like to bring up with me before we begin? Okay. So it's this shoulder, is it? Okay. How did you hurt it? Right, I see. Okay. Alright. Well, as I'm kind of having a little feel here, I think what's happened is that when you've been working those muscles just at the top here, I think what's happened is that either you haven't warmed up properly before exercising, or you haven't cooled down properly, or maybe that your form when you're lifting weights was a little bit irregular, or you weren't sort of mindful of it, so you may have caused an injury there. But from what I can feel, there's no sort of damage there. It's probably just a muscle strain. I think just maybe put some ice on it to take that swelling down, then keep it nice and warm after the swelling goes down, just to relax the muscles. Maybe take a couple of hot showers or a nice warm bath. That will do wonders. Okay. And any other causes for concern that you'd like to bring up with me? No. Okay, so first of all, let me just get you to confirm your name and date of birth. Okay, perfect. And do you consent to me carrying out this annual physical examination on you today? Perfect. So, list of current medications. Has anything changed from last time? So you're not taking that one in. Okay, let's make a note here. Okay. Are you taking any over-the-counter drugs or any herbal supplements? No. I've already asked you about pain and symptoms, so that's fine. Let me just pull up your recent tests here. You haven't had any tests in the last 12 months. Okay. And have you had any family members being diagnosed with heart disease, cancer, glaucoma, high blood pressure, or any other major or minor diseases in the last 12 months? Alright, any major or minor surgery since your last visit? No. Any visits to the emergency room? No. And any other sort of minor illnesses this year that you've had? Maybe cold or flu? No. And has your diet changed since your last visit? Right, so you're reintroducing that protein back into your diet. Okay. I'll just make a note of that. And has your consumption of alcohol changed since your last visit? Oh, so you've cut it out entirely. Okay. And smoking, you still don't smoke. And exercise, has that changed in the last 6 to 12 months? More or less exercise? Okay. And how many times a week? I see. Okay. That's fine. So that's all the questions I need to ask for now. Thank you very much. So if I could ask you to just pop your jacket off and sit in the seat just behind you, we'll begin the examination. Okay? Alright, so you're nice and comfortable. That's perfect. So I'm going to listen to your heart and lungs now. I remember last time your heart was really, really healthy, really, really strong. So I don't suppose anything's changed this time. Well, fingers crossed anyway. So if I can get you to lift up your shirt a little bit, hopefully this won't be too cold because it's quite warm in here today. So I'll just be very careful when I put it on your skin. So I'm going to listen to your heart, so just sit nice and still for me. There we go. Okay. Good. Okay. Heartbeat is very strong, nice and regular. Can't hear anything abnormal, which is great. Okay, so your heart is perfectly healthy. Now I'm going to be listening to your lungs. If I could just get you to breathe normally first of all, and then I'm going to instruct you to breathe in deeply and out very quickly, okay? Just in your own way, that's fine. Just lift your shirt up again for me. Thank you. Just breathe normally. Okay, around the back. Yeah. All right. Now take a deep breath in for me and out. Deep breath in, out. Deep breath in, out. Deep breath in and out. Alright, so your lungs are nice and clear, nice and healthy, so no causes for concern there. Alright, perfect. So now I'd like you to just hop on the scales and I need to take an updated weight measurement. Yes, they're just behind you there. Just pull up the software here because they're digital scales. Oh, could you just hop off just for a second? I need to just calibrate it to your file here. Okay, yes, you can pop on now. Okay. Right, 2 seconds. 1, 2. And that's synced to your file. That's fine. Yes, you can come off now. That's perfect. Your weight hasn't changed from last time, so that's good. Just need to take an updated waist measurement as well. So if you can just sit forward for me, that's perfect. Let me just get this tape around your waist here. Alright, that's great. Just input that into your file here. Calculate your BMI and your waist ratio too. Alright, that's all perfect. BMI is looking great. So now I would like to just take a look, just a quick inspection of your skin and your hair, the hair on your face, and also your hands and nails. So just be taking a look, just with a little light here, skin on your face, and your scalp. Now, your skin is a little bit on the dry side. Do you use any skincare products or anything? Alright. Your scalp does look a little bit dry. Again, what hair care do you use? Okay. So nothing that's going to cause this dryness then. I see that just the outer corners of your eyebrows are a little bit patchy and your eyelashes are a little bit sparse as well. Okay, I could have a look at your hands as well. Okay, now have your nails become a little bit more brittle recently? Have you noticed any changes to your hands? Okay. Sweaty hands or dry hands? Alright, when was the last time you had a full thyroid blood test? Okay, right. I think I am going to actually request one on your annual blood test. I'm going to do a full thyroid panel which tests TSH, also T4, all your B vitamins, and pretty much anything associated with your thyroid. I'm just a little bit concerned that this dryness has kind of come out of nowhere, and also your nails are a little bit brittle. Have you noticed any changes to your levels of energy, your mood? Have you sort of noticed anything which you think, you don't pay too much attention to it, but it's kind of niggling you in the back of your mind? Okay, that's interesting. Any swelling of the throat, difficulty swallowing, sort of pressure in the throat here? Okay, well that's not a problem. I think I'll do a little bit of a thyroid exam on you today and get those blood tests ordered for you. Okay, so now I'm going to actually take a look inside your eyes. So just look straight at me. I'm just going to check the pupil dilation here. That's good. Any headaches, blurred vision, flashing lights? Okay. And do you have a prescription for glasses? Alright, do you wear those for driving? And do you wear contact lenses? Okay, not a problem. I'm just going to come a little bit closer to you and just check inside your eyes here. Any pain around the eyes, any tenderness to the eyes at all? Any dry eyes? Excess watering of the eyes? Okay, no, that's fine. Okay, not a problem. When was the last time you saw your optician? You're due an eye test soon. Oh, okay, that's fine. So, I'm just going to swap over the Stethoscope here. I'm going to take a look inside your ears. Now, you had some ear cleaning a little while ago. Yes, was that a regular visit? I remember you had a little bit of problem with earwax, is that right? Caused by wearing your headphones a lot. That's right. And you had a little bit of hearing trouble as well. And has that improved? Alright, that's perfect. So I'm going to take a little look inside your ears now. Alright, let's take a look inside this ear. Yep, that looks amazing. Lovely and clear, lovely and healthy. This ear, again, excellent. Nice and clear, nice and healthy. That ear cleaning has worked wonders. So now I'm just going to do a very, very brief whisper test from ear to ear. And I want you to just repeat back the word that you hear. And also I want you to close your eyes as well, just in case you felt the need to lip read. Alright, just close your eyes. Money, socks, sand. Okay, and this is it. Follow, path, sunshine. That's excellent. Alright, so now I'm just going to grab this tuning fork and I want you to tell me when you stop hearing it vibrate. Alright? Just tell me when it stops vibrating. About there. Okay, the other side. Just let me know when it stops vibrating. How about there? Alright, now I'm going to place it on the centre of your forehead, and I want you to let me know if you hear it better on this side, or right in the middle, equally on both sides. Alright? So do you hear it more on this side, or equally? Okay, perfect. So now we're going to place it behind your ear, this side, then this side. And I want you to tell me if you hear it more on this side, or equally. Okay? This side first. This side, and this side. Do you hear it equally or favouring one side or the other? Okay, that's perfect. So now I'd like to just take a little look up your nose. I know that you suffer with seasonal allergies, right? How have they been this year? Let's see. Right, that's perfect. So you're preventing them before they even begin by taking some antihistamines and eye drops and nose spray. Well, that's perfect, and that's something I encourage all my patients to do. It's better to be safe than sorry than allowing these symptoms to transform into sinus infections, rhinitis, sore throat. It's very uncomfortable, so you're doing the right thing. So if I can ask you to tilt your head all the way back, just going to place this inside your nose a little way and open it up a little bit. It can be a little bit uncomfortable, but if you experience any pain at any time, let me know, okay? Let's just tilt your head back. Okay, let's have a look. Okay, it's all nice and clear, free from irritation or inflammation. That's great. The other nostril. Good. Free from irritation and inflammation. Okay, that's perfect. I am really, really happy with that. So now I would like you to identify a few scents, okay? So the first scent I have here, I want you to identify what that is. That's right, coffee. And what is this scent? Peppermint. That's good. And what is this scent? Vinegar. Perfect. That is great. Okay, so now I just want to take a look at your facial symmetry, muscles in your jaw, eye muscles. So first of all, just look straight at me. Have you noticed any tingling, numbness, or any drooping on your face or eyes? Okay. And what about tightness around the jaw? Do you clench your teeth? Okay. Puff out your cheeks. Now I'm going to place my hand under your chin. I want you to try and force my hand down by opening up your mouth. That's good. Now scrunch your eyes up really tight and try and open them. Okay. Now open up your eyes really wide. That's good. Relax. And then give me a nice big smile. That's good. And relax. That's perfect. Alright. Very good. Whilst we're here, actually, I'm going to have a feel of your thyroid, okay? So, does it hurt when I press it like this? Alright. Have you noticed any swelling in your neck? Any lumps? Or any sort of nodules that are a little bit concerning? Okay. Problems swallowing, a little bit dry. Okay. Alright, so there's no swelling or obvious physical abnormalities that I can see, but I think those blood tests are going to cover that for us. Okay. Good. So now let me take your blood pressure. I remember last time it was a little bit high, but I believe that was down to your personal circumstances at the time. Have you managed to resolve those? That's good to hear. So you're feeling a lot more calmer, a lot less stressed. Alright, that's good. So just hold out your arm for me. Let's go around your arm. Okay, so it is going to get a little tight, but nothing too unpleasant. So okay. So blood pressure is still a little bit elevated, but honestly it's nothing out of the ordinary, just slightly on the high side. Are you still sort of feeling anxious or stressed about anything? I see. Are you doing anything to kind of mitigate that stress or help yourself in any way? I understand. I've heard it's very, very effective. So, yes, keep on doing that. I will just sort of remind you to maybe keep an own log of your own blood pressure. There are a couple of different tools you can buy online to monitor your blood pressure from day to day. So, maybe that would be a good thing to look into. Alright, so now I just want to have a little feel of your stomach. Just going to palpate the stomach here, and you just let me know if that hurts or is uncomfortable. Okay, and how are your bowel movements? Any bloating? Any sort of food intolerances? Okay, I remember you were suffering a little bit from IBS last time. Yes, just stress related. Okay, has that calmed down now? Okay, I don't feel anything that's a cause for concern, so I think that's all perfect. Now let's have your hands again. Now take both my hands and I want you to squeeze them as hard as you can. No, don't worry about hurting me, it's fine. Alright, and relax, that's good. Now I want you to make a fist, make wide, make your fingers nice and wide, fist wide, and just keep doing that. And stop. Now I'd like you to rotate your wrists one way and then rotate them the other way. That's good. Any pain in the wrists at all? Okay. Do you spend a lot of time at the computer? I see. Okay. Well, the mobility of your hands and wrists is quite normal, but if you're feeling a little bit of discomfort in your wrists, then I would just maybe have a look at your workstation and maybe see if you can improve it to make it more ergonomic with wrist straps, wrist rests, maybe changing where you put your monitor and your keyboard. I think that might help that little bit of discomfort in your wrist. Alright, so that brings us to the end of your annual physical exam for this year. I'm pleased to say and pleased to give you a full bill of health pending the blood test results. I will schedule an appointment for you to have those. Actually, if I email you our online booking system, that will probably be easier because then you can book a time which suits you and which suits your schedule rather than us booking it for you and then you have to reschedule it. Does that make sense? Alright, perfect. Well, I will send you a reminder appointment for a year's time via email. But until then, take care of yourself and I look forward to seeing you in a year's time. Take care. Bye bye.